get into it. Number 2, okay? So as you guys see, I'm at my hair appointment, but I definitely want to give you guys some knowledge, okay? So let's go. What I was saying earlier was, how can we prevent infections at the surgical sites? Let's wash our hands, okay? Let's wear our gloves. Let's keep our incisions covered, and let's keep our surgical sites clean. Make sure that the person that's providing you care is maintaining their proper hand hygiene, okay? Make sure that the surfaces that you're putting your items on are clean and secure, okay, everybody? Let's follow all of these things so that we can ensure that we do not get an infection, okay? If you do have an infection, these are signs and symptoms, okay? Fevers, chills, redness to the area, swellingness, pain, bleeding, nausea, vomiting, all these things are signs of infection. Now listen, when you all are post-surgery, the doctors usually give you antibiotics in order to be prophylactic, okay? But that does not mean that if you get an infection, it can 100% treat the infection. If you are to get an infection, you have to go to the doctors. If you have leakage, pus, whatever, they'll do a culture, they'll test it, they'll see if they have growth on the culture bottles, and whatever the culture says it is, they will treat you with a medication, antibiotics that are pretty much meant to cure and or treat that particular bacteria. So say, for example, gonorrhea, we don't use the same thing to treat chlamydia, okay? So if you want to kind of get in that type of mind frame like that, there are certain bacteria that are out here that certain medications do not cure. We have broad, we have general spectrums. So just make sure that you're doing everything that you need to do to ensure that you are getting the proper infection control care as possible. It is truly so important, because it is really life or death. Okay, so we're going to do a rundown on part 3.